Welcome to Nursing Express. Nursing Xpress. Yes, now is your time. Let's jump right into your scenario. You are on the clock. Help me, nurse. I visited the doctor's office with pain in my wrist. The nurse, that's you, explained that I was diagnosed with carpal tunnel syndrome. Which statement indicates effective teaching was achieved? So you, the nurse, taught something to the patient and they show you that they truly got what you were teaching. Think of some answers and let's see if you match up with what we have here. Ready for the answers? Here we go. A. The condition is caused by radial nerve compression. B. Wrist immobilization splint is recommended. C. Wrist splints are worn at night during sleep. D. Hyperextension or hyperflexion of the wrist causes inflammation of the tendon. E. Apply elastic compressions to the wrist. All right, so let's take a look at the answer choices again. Condition caused by radial nerve compression, let's see. Immobilization of splint recommended, immobilization splint. Wrists are worn during sleep. Wrist splint, there's a night component to that answer, but maybe D. Let's see, hyperflexion, extension of wrist cause inflammation. How about elastic compression to put that on your wrist? Let's see. In order to answer this, you clearly have to have an understanding of the disease process that is carpal tunnel syndrome. Think of the answer. I'll give you a few, and let's see what we come up with. So the answer is B, C, and D. All right, so you can pause and look at the answers, but let's keep going and we'll understand why the answer is what it is. Hey, real quick lesson on carpal tunnel syndrome. So basically, carpal tunnel refers to the space underneath the transverse ligament. Also, the median nerve runs through that ligament. So basically what happens with carpal tunnel syndrome is a compression of that nerve, which causes issues and problems with signal being sent back and forth. As you can see here, the median nerve is compressed in the carpal tunnel. And that's what we have our situation. Get it? Got it? Good. Let's go. Again, as we said, it's a compression of the median nerve, not the radial, not the brachial, not any other nerve, just the median nerve. If we look here, we can see some issues that are caused when you have carpal tunnel syndrome. Here is an example of what we call palsy, median nerve palsy, where there's a bit of a stuttering in the hands. And here you can see where the compression and the signals are being sent. And when you have a stop of that flow of the signal information, you can also have pain going throughout the hand. In order to not worsen the problems that we're having with carpal tunnel syndrome, the simplest thing to do is not apply pressure to the area. So that means do not put rubber bands or wristbands or any type of compression onto that area, onto the median nerve. We don't want to put more pressure on there to cause problems with the signals going back and forth. So take off those rubber bands. Take off any compression. Is it that simple? Yeah, it's that simple. Now this is to really drive the point home. See that compression? See how it's wrapped around the arm? Basically what you're doing to your hand is this. Ha! Wow. What do we have here? Uh-huh, you guessed it. It is a wrist splint. Okay? So it prevents compression on that median nerve. How does it do that? It does that by immobilizing it. That means it just keeps it in place. So that gives us more answers to our scenario, correct? So it helps us to keep it in place, and that when it stays in place, it helps to prevent hyperextension and hyperflexion, which would cause what? Inflammation of the tendon, because we start to aggravate the area more and causing more problems. So all you gotta do is slip this bad boy on, and you're good to go. Thank you for watching. While you're here, hit the like and subscribe button, and don't forget to hit the notification bell to know when we put up more videos. Remember, study smart and keep your process of thinking sharp.